Hi, my name is Jill Charbonneau and I'm president of the Vermont AFL-CIO. We're here today to talk about S53, Universal Access to Primary Care. This bill is in the Vermont legislature in the House Healthcare Committee. On Wednesday, it will be voted up or down. The bill encompasses a committee of stakeholders to define what primary care would look like and discover the feasibility of delivering it, whether it be publicly financed or a coordination of payment systems within the current healthcare arena, which would be a copay for an insurance company, etc. And the Green Mountain Care Board will report to the legislature in January of 2019 whether or not this is feasible. And if it is feasible, in January of 2020, the Green Mountain Care Board would then present to the legislature an operational plan.
My name is David Hills. I'm with Waypoint Management Services, and the bulk of my career has been over 25 years spent in management consulting with large health systems and hospitals in particular. I spent a great deal of time working with doctors and in emergency services and emergency departments in organizations across the country. When Jill first mentioned S53 to me, it struck a nerve because I know about the kind of misuse that happens in emergency rooms, and this is a large driver of our healthcare costs in general. Primary care costs about 1/10 of an emergency care visit, and what we see here in Vermont is that about 90% of 85 to 90% of those health emergency room visits actually go home. And of those that go home, instead of being admitted to the hospital, you could consider 50% of them could have gone to their doctor or a primary care provider instead of going to the emergency room. Why that happens is a mix of, number one, a person doesn't have insurance and knows that the emergency room has to take care of them, and or number two, their primary care provider cannot accommodate them quickly enough. And so those are two areas that I feel that this bill would in particularly address. So if we're talking reducing healthcare visits by 40 to 50%, imagine the kind of dollars that would drive to our healthcare savings in general.
Primary care is 6% of the cost of total healthcare spending in Vermont, which is about I would say in the neighborhood of $6 billion. It's estimated that this primary care, universal access to primary care, even if it were publicly financed, would be about $200 million. And most of the testimony that we heard in the public hearings were from people like myself who had a healthcare story to tell about the access and the affordability. But the voices that really seem to draw the attention of the legislature are those of the insurance companies and the hospital groups. Now, the hospital groups, for the past 3 years, have been over budget for net revenue, for net patient revenue. In 2015, it was $49.2 million. 2016, $60 million. And last year, 2017, was $23.7 million. However, UVM and Porter Medical Center, which now affiliates with UVM, and the Central Vermont Hospital in Berlin, all partners of UVM, came in at $43.8 million. Recently, hospitals have, particularly, once again, UVM in Burlington, underwent a $170 million renovation to have private rooms for better patient outcomes. I suggest that investing $200 million a year in primary care will do much more for better patient outcomes. This legislation would serve every Vermonter.
That's good information, and that provides a good segue into the next point I wanted to make about some of the diagnoses of those folks that are sent home from the hospital, in particular the ER. These are all the people that don't need ongoing care, immediate care, acute care, emergency surgery. These type folks get sent home, usually with follow-up orders to see their primary care doc. Now, if you talk about someone that may have come in with a broken bone, well, chances are these folks are going to go home too. So if I broke my arm, I'd have my arm set, and I'd be sent home with a follow-up order to see an orthopedic surgeon. That doesn't discount the fact that they needed to go to the emergency room. However, here are some of the diagnoses that go to the ER and yet get sent home same day, don't get admitted, that are over 90% discharged. In other words, they're not admitted to the hospital. Some of these include diseases of the skin and subcutaneous tissue. You know, somebody gets a rash or a burning sensation or an itch, they're going to the emergency room. And these people are discharged 96% of the time. Injury and poisoning. These folks get sent home 95% of the time. Some symptoms, signs, and ill-defined conditions, which is a rather general care category. Not feeling well, feeling icky, maybe it's the flu, I'm not sure. Those folks get sent home 95% of the time, and so on. So the point I'm trying to make is that there is so much care that the emergency room is providing that not only is unnecessary, not saying that the care isn't needed to be provided, but not needed by the emergency room, or it's taking up time that they should be delivering to the people that actually need the emergency care.
I would like to comment on something that was told to me by one of the members of the House Healthcare Committee in the legislature, and that was, well, there are a lot of people who feel like waiting for the feds. Well, I suggest to you that the federal government is in no sort of agreement on Obamacare, and they can't really put together a highway budget. So I would like to see us rely on Vermont. You know, we have been first in a lot of things, whether it was outlawing slavery or giving women the right to vote. And in my lifetime, we approved civil unions and also same-sex marriages. I think this is a great time for Vermonters to step forward, not only because it's the right thing to do, but also because it helps every Vermonter get the adequate care that they need and helps us build a delivery system so that there will be primary doctors in this state.
We in Vermont pay too much for health care. And even if our employers provide our health care, chances are they're taking a good chunk out of our checks every week. Generally, the health care costs are too high, not just in Vermont, but all over the country. What we can affect today and this week and in the near future is to move forward this bill for further access on universal primary care. This would carve a lot of costs off the top line of the general healthcare costs, reducing our insurance bills, reducing healthcare costs in general, and actually helping our employers pay our bills as well.
At the end of last year's legislative session, the whole budget was stalled over the health care of school employees. Now these employees are paying more and receiving less service. And now the Vermont state employees, through their negotiation system, have found that they are going to be paying more and receiving less. It's time for us to act to improve access to health care for all Vermonters. Please contact your legislator, and particularly if they sit on the House Health Care Committee.